Welcome to Caribbean Wellness. I'm Dennise Demming. We focus on emotional, psychological, and social well being. Join us for our conversations on well being and mental health.
Well, Denise, I started off my career in the 80s, mid 80s, as a social worker. I was trained in Jamaica, the Mona campus, and my formative practice was done in Jamaica. I returned to Trinidad in the late 80s and into the 90s and worked as a medical social worker within the hospital setting as well as the community setting.
How concerned are you about mental wellness?
I am very, very concerned. There are lots of things going on in the world, in our country, in communities and families. And we see it on the news every day where persons are becoming enraged and, killing each other, as well as we have seen in the recent past where, there's been difficulties between the law enforcement and persons with mental health issues, and some of them unfortunately losing their lives. So we are at this point in time in our country in particular in a very, very difficult place. And as someone who worked as a social worker in the community, in particular and in hospitals, I worked with vulnerable children, took them before the court for care and safety. And I am very concerned that a lot of our children and young people are not experiencing the best of their childhood. They're not having a very healthy childhood. And of course, that leads on to difficulties in their adult years, with things like depression, self-harm, suicidal thoughts, schizophrenia, bipolar. Yeah, so it's starting. I think a lot of it is rooted in the fact that children are not experiencing or having the best experience of their early years.
What can a parent do?
Parents need to be to be prepared to be responsive to their children's needs. Parents need to be vigilant. If your child is being mercilessly bullied by someone at school, you must be able to notice that there's something that is wrong with your child. If your child is looking constantly sad, is saying that they don't wish to go to school, you're hearing your teenager saying that they wish they weren't here, they prefer not to be here, they're losing friends, they're being very isolated, they're not being as chatty and lively and not engaging, with their friendship groups as they were previously. You need to start taking notice. There must be something that is happening that would cause the change. All of the time, the children are the casualties in these families that are breaking down. And sometimes it takes a long time before parents notice or even pay attention to the fact that, look, something could be happening here for my child. Okay, yes, I'm experiencing this issue in my relationship. Yes, I don't love my partner as I used to. However, if we both share in common children, offspring that we brought into this world, something must be happening for them as well. And I think the absence of dialogue with the children could really lead to a lot of problems.
Well, let's just switch the conversation a little bit and go to the business community and the workplace. What can be done to normalize mental wellness in the business sector?
Many companies in Trinidad and Tobago, well, at least the larger companies, the larger companies would have in place an EAP program. I would encourage employers to use that resource, have your lunch and learn, you may have your lunch and learn sessions or you have access to lunch and learn sessions, use those opportunities to raise awareness of mental illness and how it can affect the individual, how it clearly affects them in the workplace. You have things like absenteeism, high absenteeism with individuals. You have agitated employees who might be snappy with their colleagues. They need to know that all of this could be a signal that there is something that needs to be addressed. Introduce the whole idea of self-care. Because the thing is, if you have an employee who is well, they're going to be more productive.
Can we just take the conversation? We've talked about children, we've talked about parents, we've talked about the workplace. Let's talk about the national community. What do you think in terms of the national community we can do to just improve the level of wellness?
I think the communication around mental health needs to improve within the national space. Lots more can be done to improve awareness. The ministry needs to lead the charge in terms of destigmatizing the whole idea of mental health. There's a phrase that was coined in the UK that said, there's no health without mental health.
What a wonderful phrase. There's no health without mental health. Without mental health. And as we bring this interview to a close, what are your parting words that you'd like to share?
Well, I would like us to really be a caring community. Whether we are in the workspace, we're in school, I want us to be much more caring and considerate and, express more empathy for our colleagues, our schoolmates, our students, get the information. If you don't have the information, get the information. Be considerate, especially as employees. You have an individual, even from the interview process. I think it needs to start from the recruitment. If you have an employee who has been, affected by a mental health issue, be prepared to offer that person the space and time to heal, in terms of time off, in terms of maybe even supporting them to have a mental health assessment, whatever it takes, and even in terms of making adjustments to their workday. There are some people who are on medication and they take medication in the morning, they go to work and they could be a bit drowsy. You don't put them to interface with the public. You don't want their colleagues to be laughing at them. You want to make the necessary adjustments that would make them fit comfortably or feel comfortable in that space. So those are some of the things I would want to say. Let's be more caring as a community, as a society, towards those individuals who are really, under the cosh of mental illness. And mental illness is not necessarily those people who are, walking down the road with their hair in tatters and their clothes falling off. There are people who are very depressed and they are in the workplace, they're in the workspace, and they seem to be thriving. But if you go beyond the first question, you might really get the facts of the matter.
Thank you very much, Marcia. Caribbean Wellness, a space to talk about our well-being and mental health. Like and share our editions. Until next time, be safe.